Everyone, it's DocTalk. We're really coming up on May and true springtime activities. Be careful this time of the year. It's prom season, it's going to wedding season. Kids sometimes distracted by first outdoor activities, first use of motorcycle, bicycle, etc. Really time to be safe outside. A lot going on in our world and a lot that is changing rapidly with changes at the federal government level. For those of you in public safety, the changes going on in Washington impact what we're doing. And just a reminder to pay attention to all of our associations and societies who are working to preserve programs that have a lot to do with public safety and the safety of public safety, which is all of our U.S. Fire Administration, National Fire Academy, NIOSH, Fallen Firefighter, the National Fire Cancer Registry, etc. All of those programs have been disrupted. I'm going to talk about data, and our data programs have been disrupted because the CDC, the U.S. Fire Administration, and probably NHTSA all have data programs, and they have all been impacted by the new government work that is going on. So we're at a point where many of these things we really need. And for our fire people, we need our cancer registry, we need our injury registry, we need the prevention programs, we need the leadership of the U.S. Fire Administration. And right now, all of those programs are compromised. So let's make a concerted effort to try to get our elected representatives supporting those important programs. I want to talk today a little bit about an unusual topic, but it is very timely for our entire audience. That is the data that drives the emergency care system. Over my last 30 years, I've been involved as the data geek for emergency care. And my role is with the CDC, with the emergency department groups that look at the data for emergency care. And let me just give you some summary information. The emergency departments in this country have been building volume since World War II. And that volume goes up about every year by 2 to 2.5%. That's important because emergency departments in this country, frankly, have been shutting down more quickly than we have been building new sources of emergency care. So our emergency departments get busier and busier. And the reason they're getting busier is because we have people whose lives are still contributing to us. They just happen to be in an older age group. And as we build more people into the older age groups, they use the emergency departments more. They use our EMS services more. They use all of our healthcare resources at a higher level, but oftentimes that access is through the emergency department and through the EMS system. So our emergency departments get busier. They are filled with sick people in general, as opposed to hurt people. That is because many of our injury prevention programs have worked successfully in preventing people from getting injured and in particular serious injuries that would result in them going to emergency departments. And oftentimes, fortunately, injuries less severe still occur. Ankle sprains, little lacerations, bumps to various parts of the body, etc. And our urgent care system works very well in taking care of those individuals. So the emergency department has an increasing population of older people with illnesses. And it takes a long time to work those people up and figure out whether they're sick enough to require a move to an inpatient bed upstairs in the hospital or whether they can safely and effectively go home. An important part of the world now is the development of community paramedicine, or what are called mobile integrated healthcare programs, that allow more health services to be delivered at home as opposed to somebody coming into the inpatient area of a hospital. A lot of people don't like being in the hospital and are not anxious to be admitted to the hospital. So we are working hard at developing more programs to improve care outside the hospital and to allow people to go home from the emergency department after a workup looking for a bad disease that fortunately is not there. Be aware when you go to the emergency department, it's a busy place and they're looking for the most seriously ill or injured patients to come in. They're looking for strokes and heart attacks and bad pneumonias. We just lost our Pope to really complications of pneumonia that caused him to have a terrible stroke. And we have to be aware that emergency departments are very full of sick patients who are trying to get they really want to get tuned up and then turn around and go back home and follow up with their physician or other medical resource out of the hospital. But in order to do that, we have to have more people going into the emergency care system. We have talked on this broadcast about getting people to join us in the emergency care system. And many of the people who want a career in emergency care start as an EMT or start as a basic firefighter or a volunteer firefighter. They find a way to serve their community and look at the field of healthcare as their future. We look forward to having many of those people come aboard and evolve into emergency providers at the highest level. Many EMTs go on to become paramedics, and then they go on to become a physician assistant, a nurse practitioner, a physician, a respiratory therapist, or a hospital CEO. And I'm at a conference now, and one of the CEOs that talked to us about emergency care was an EMT as their introduction to the healthcare system. So EDs, busy places, EMS, busy, particularly at this time of the year. It's a good time of the year to be safe, and it's a good time to recognize the systems that account for and make safer our system of firefighters, EMS, law enforcement, and others. So let's help the federal government make some good decisions. Where necessary, let's help our state and local governments make good decisions about the public safety system and get our systems that integrate all of that together back together. This is Doc Talk, a little bit of a weird topic this time around, but a very timely one. Stay safe. And the next thing we're going to be talking about in earnest is hot weather and hot weather protections as we move into May. Stay safe and stay healthy. Thanks.